Thank you all for coming. Feel free to get up and get food and drink as you need, though. Welcome to the 2018 Pierce County Sexual Health Educator Update, and we're super excited to have you all. So my name is Kate Cranfield, and I'm a public health nurse here at the health department. And we also have some great speakers that have come out to discuss a few things. Here is our agenda. Once I'm finished with a couple housekeeping things, we'll have Beth Juchui from the health department. She is another nurse here, and she works down with the STD HIV clinic, and she's going to be presenting STD trends in Pierce County and provide some local resources that would be available for students. And then we have Oasis Youth Center. There's a couple youth leaders and one of their staff members will be here to kind of question, answer, and discuss challenges that LGBTQ students face at school and some resources to help combat those challenges. And then we have Lucerita Wendinger from Consejo Counseling, who's going to be talking about healthy relationships for teens. So we're super excited. And so if you need to use the bathroom, they are outside the auditorium across the way. Feel free to use those when you need. There are a couple exits. Here's one exit down here, and then the main exit in case of emergency. And just an FYI, the front doors do close at 4:30. So if there is security here until 7 p.m., but if you do need to go out to your car or something, check in with the security person to make sure she can hold the door for you or let you back in so we don't lock you up. And just keeping in mind that there's no smoking on the health department campus. And if you did have clock hours, I'll be returning the copied forms. I can come find you during a break, or you can get them when you turn in your evaluation, whichever works for you. And there is a separate sign-in for the event and then the clock hours. So just check in with me if you need one of those sign-ins. And there are a few handouts in back. Make sure you grab those. And then I think most people have food, so that's good. And again, thank you all for coming. And portions of this presentation are going to be recorded, so just keep that in mind if you are asking questions. And we're hoping to be able to post it online for folks that are not able to attend in person. The whole presentation will not be recorded, and clock hours are not available for folks that didn't come. So thank you all for coming live in person. And here we have Beth Juchui, our first speaker.
Thank you, Kate. Hi, everybody. I'm going to apologize in advance. I'm fighting a cold, so my voice is not 100%, so I will try my best. In case we get to a point where it's going down or getting weary, I will do my best. But just bear with me through the portion of the presentation. Like Kate mentioned, my name is Beth Juchui, one of the other public health nurses here. My main focus of the health department is the HIV and STD department. A few objectives for today, why we had you come today. We are going to go over some current data on STD and teen rates as far as gonorrhea, chlamydia goes, HIV. We are going to provide you with some resources as far as testing and treatment that may be applicable to you if teens have any questions on how they can get access to these resources. And also, we are going to talk about some challenges that face the LGBTQ population and how you, as the people working with them in schools, maybe have any questions or they come up to you. Hopefully, by the end of this presentation, you may feel better equipped to address or answer some of the questions. And if not, we'll have contact information for people we can refer you to that may be able to better help you answer those questions. Okay, and so the data that we're going to be looking at today is based off surveillance data that we received at the health department to July of this year. But as far as the year to date count is 2017. And so looking at this, we're just going by the diseases, comparing Pierce County to the entire state as far as cases go. And so you can see chlamydia and gonorrhea way up there, with chlamydia in Washington State being highest. This is just an overall between Pierce County and Washington State, and the slides coming up will break it down by gender and as well as age. And I will make a disclaimer right now that when we refer to gender in any of the data sites that I have, we have it broken down to just male and female, and we do acknowledge that there are other gender types out there, but we don't have any quantifiable data to use as of right now. So that is something that we're working on, and hopefully in future presentations we'll have data that we can actually use that will break down to the other genders. So I just want to make that acknowledgement right now. Okay, and this is the incidence rates. We're comparing King County, Pierce County, and the entire Washington State. Is the lighting okay? Can everybody see okay? Yeah, okay, perfect. And so as you can see, Pierce County, we're up there in blue, we're taking the lead on chlamydia. Not a good lead to be on, but it is what it is. And we're kind of comparing the years from 2008 to 2017. And King County and the entire Washington State kind of seem to be on the same trend. And then down here, it's just broken down by the years and the number of cases per year that were reported or counted out. Okay, and so, this slide right here is the one that breaks it down by gender and age. So as you see for chlamydia, we don't have a lot of data for 10 to 14-year-olds. Most of the data kind of starts from 15 going on upwards. And as you can see for chlamydia, females have a high incidence rate for that compared to the males. And then if you compare the second graph on my left is just comparing the years of diagnosis for the last 7 years, from 2010 to 2017. And again, we see for the female, it's just been like a steady increase. And even with the last month, I think when the CDC had their national conference, it just seems like chlamydia is just on the rise, and not only in Pierce County, but it's like a nationwide, thing that is going on. So that's something to take note of, especially for that age group. 15 to 24 is where we see like high incidence rates among the females. They have high numbers. It kind of drops off from there, but they still tend to have more incidence compared to the males. Okay, and then looking at the gonorrhea incidence, this is graphics comparing King County, Pierce County, and the entire Washington State as well from 2008 through 2017. Kind of dips around for Pierce County. It looks like we were doing okay in 2008, had a steady decline with a plateau, but then not sure what happened in 2012, and then we just kind of took the lead. 2016 went down a little bit, but then we're back up for the end of the year 2017. So it seems like with gonorrhea, the rates have been kind of going up and down, versus when you remember the match with chlamydia, it just has been like a steady increase with chlamydia rates in the county. King County, not too far behind us, and then the entire Washington State seems to be doing a little better than we are doing here in Pierce County. So again, that's not something that we want to celebrate, but it's something, we want to call action to, especially for our teams as well. And so these two graphs, again, breaking down the incidence rates by gender and age. For gonorrhea, the one thing that I noticed is the 15 to 19, again, it looks like the female population takes the lead. And then when we get in the 20 to 24, the rates change, where we see the male take a lead on gonorrhea between 20 to 24, and that was a difference to the chlamydia graph that I showed earlier, it did seem like for chlamydia, females just seems to have more incidence rates throughout the age groups. But for gonorrhea, we do see the change between the 2024, where males have a higher incidence than females as far as gonorrhea goes. Looking at the other graph, it's just a comparison from 2008 to 2017 for the rate, and between the female and the male kind of looks similar, and then we do see that the female around 2016 there was a decline, a little dip there, and then it went higher, but the male do seem to have higher incidences of gonorrhea, and that is even what we see in the clinic here when we have people come in for testing and treatment. That does seem to be true. We do have a lot of chlamydia, mainly in our female clients, and then gonorrhea, mainly in the male, but then you could have where somebody has both of the infections at the same time. So that is something else that we see as well. And so the other few slides that are coming up are just on primary and secondary syphilis. We did not go in depth as far as breaking down the stages of syphilis. It does tend to get complicated, but we did want to show just the rates that we have comparing for King County, Pierce County, and the state as well. And that, well, this time, looks like King County does take that one, so yes, we're not doing too bad, but still, we do have some rates, and the last few months, we've also been seeing increase in syphilis cases in the clinic as well. For the longest time, we've only usually when we have like an increase in STDs, mainly we see chlamydia come out first, and then we have gonorrhea. But then the last few months, with the cases that we've been seeing in the clinic, there has been an increase in syphilis as well. So that is something else just to keep at the back of your mind. Usually syphilis is not mentioned that much. Usually chlamydia and gonorrhea will be the top for the last few months. Even in the clinic, we have seen cases coming in with an increase in syphilis as well. So we are keeping track of that as well. And then this is just breaking it down again by gender and age. Mainly the data that we were able to get and compile for this was mainly male for syphilis cases. If you look at the other graph, just kind of comparing female and male, you do see the female cases are not as much. It kind of seems to be on the same line with a plateau. But for the male, as you can see, it just kind of took up from 2013 going upwards, and it has been on the increase since then. And then for the age groups, the main one is the 2024. Again, it's where we see male having higher rates of syphilis as well. So we did put a slide as far as HIV goes. This first one is comparing, again, King County, Pierce County, and the entire Washington state. And even on the cases that we see in the clinic, Pierce County, we don't see usually a lot of cases, but we are starting to see them, especially with the MSM population. We are starting to see new HIV cases with co-infections, usually with either gonorrhea and HIV, mainly with the MSM population. But King County overall does have a lot of new HIV cases that we see. Compared to Washington state, for Pierce County goes, seem to be doing maybe close enough to the Washington state, the entire state numbers as far as HIV goes. And this is just breaking it down again by gender and age. And as far as the 15 to 30, 15 to 19, we did not have any quantifiable data, which to me is a good thing. It means that the younger population is really not getting HIV, which is what we really want to focus on and prevent. So the data that we have set from 20 to 24 is when we were able to start getting data as far as new HIV cases go, and that is in Pierce County. And then the 25 to 29, that's where we had most of the cases in that population. But then 30 to 34, and then from there it kind of dies down. And then the 40 44 usually is a population that is usually diagnosed in a later stage, like they were not diagnosed when they have HIV. Usually, some of them have progressed to AIDS when they get the diagnosis. Okay? It wasn't caught earlier on when it was still HIV. As far as the difference with gender goes, still the same female, not a whole lot of movement. But then for the male, there was that increase in 2015, 2016. It kind of seems to plateau a little bit right now. But again, males, they do have the higher incidence of HIV from what we see. And so this is the two main ICDs that we tend to see, especially in teens and in Pierce County. So this is just specific for Pierce County, looking at chlamydia and gonorrhea broken down by the male and female, and then for the total count in the county. You can see for chlamydia, we got up to 1,270 cases, and then gonorrhea, we have 212 cases, the data. And based on what we see in the clinic for the patients that come to the clinic downstairs, chlamydia rates do match what we see in the county. We do have a high incidence of chlamydia cases for what we see. As far as the patients that we see downstairs in the clinic, not a lot of teens, just because of if they tend to go to their primary provider office or use their insurance, because of the health department, we don't take an insurance and they can still come, but they have to be able to pay cash for that. So, but I'll get into that, but probably that's why we don't have data from the health department for that population, because we don't tend to see a lot of that age population, like 15 to 19, or like 19 to 24, coming through the clinic that we have downstairs. But this data we get when they're reported in from the clinic, so they do go see. So we get that reported to us. As far as the STD rates in Pierce County, so this is this one side for chlamydia and the other one is for gonorrhea, just comparing the female, male, and then all teams combined, compared to the actual county total, like the number of cases in Pierce County. So again, you see for chlamydia, female, we're up there, we're taking the lead on that. Compared to all teams, not the second line, the gray one, and then the male kind of seem to have the same number of cases compared to the actual number of total cases in the county. Sorry. As far as gonorrhea goes, females up there with all teams combined seems to have the same kind of graph going back from 2010 to the latest data that we have as of last year's count, compared to the male and then the actual cases in Pierce County. And that is, again, based on surveillance data that we received through July, for that graph that we have up there. I'm going to take a pause before we get into the map. Any questions or anything right now? Okay. So you have handouts of this map in case they're not coming out clear. We did print out the 4 maps for you. And so this map, what we're trying to do, as you can see, the density map for chlamydia, it has the school district zones into it. So you can kind of try and see where your school district lies, see how your zone is doing as far as chlamydia goes. And then the dots is, one dot represents one case of chlamydia, as shown on the map. So you can see most of the concentration is in the Tacoma area, Lakewood, not a whole lot on the Puyallup side. We do have JBLM on both of the maps, but we don't have any actual rates as far as JBLM goes. We did have a limitation on the data, so we don't have the actual cases as of right now. But once we're able to overcome the limitation we have with data, then that will be updated to show the actual cases from around the JBLM area. So it is there, but without the actual number of cases from that location. This is the same map, just kind of showing the density for gonorrhea again, and again, same thing with the JBLM area, we don't have the actual, cases, noted, but again, one dot represents one case of gonorrhea, again, same concentration, school districts, you can see, and then we try to do with the major, highways, I-5, to kind of break down the routes in, Tacoma and the Pierce County. Hopefully that works out better for you, and then this one has the breakdown of the school districts, hopefully you can try to map out where your school is, see how you're doing as far as cases or anything like that goes. Okay, I'm gonna take another pause before we get into local resources that we have in Pierce County to see if, anybody has comments, questions so far. There's a lot of maps and graphs and data, so I just wanna take a quick pause, make sure everybody's doing okay. Yes.
What is the round circle on the, there's, okay, look at right, well, on this map that says chlamydia diagnosis rate among teenagers, there's three round circles. One says decarbolis. What is that? Is that just the whole city of a whole?
This one?
Oh, that's, yeah, it's on the right one, same with the white circle, on the right one. On the right.
This one?
No, the other graph, the other map. Circle. It says it's just.
This one?
The city.
Oh, okay, yeah, this one's about destinies and this one?
Yeah.
Oh, okay. Yes, Kate.
Are there more diagnoses of chlamydia and gonorrhea in females because they are more symptomatic, or can you like infer anything like on why there's higher rates?
Oh, Kate is asking, we have to repeat the question and make sure it's getting recorded. So Kate asked a question about, why is the case that we have more cases as far as chlamydia and gonorrhea in, females. And mostly with females, they usually, can be asymptomatic. So when they actually get exposed and they have the infection, unfortunately, some of them will be asymptomatic and they don't, have anything to tell them that they actually have an infection going on, and so they tend to wait longer before going into see a doctor. And then there is also issue with reinfection, because for the males, they do have like symptoms onset when they have been exposed or they actually have the infection that will usually drive them to the doctor and they get treated. But what we see, especially in the clinic, is usually there's clusters of cases. So there could be one male partner that has different female partners. And so the main thing is with lack of treatment is we treat the male partner, but then the other female are not treated. Then it just keeps going on, and then the female count doesn't go down with treatment, but the male was taken care of because they came in, or whichever clinic they went to, they either were given a partner pack that they did not take for their own partners, or they just did not, clinicians did not ask anything about the partner. So we still have the count for the female still stay the same, where the male will come in, they have symptoms to get treated, and then that case will be closed. So they will hopefully not get reinfected from going to the same circle, which unfortunately does happen a lot. Is we'll see the same person a few months or a few times coming back to the clinic. So okay, so we'll get into some resources that can help you. So we just wanted to put this out there. According to the Washington law, if they're 14 years and older, they can consent to test and treatment for STDs. And so the only thing with that is if they do go to a primary provider where they would use the parent's insurance, then technically when the explanation of the bill is sent to the parent, it will say what the teen went into the clinic for. But unfortunately, at that point, it is not confidential because the parent will see it and they'll want to know, okay, why did you go in? So as far as here at the health department, we do not take an insurance. We don't bill insurance, so they can come in, to get tested or treated, but then they would have to be able to pay, for that service. So that's the only difference, if they really wanted to have like a confidential, access to care where the parents really wouldn't know that they actually went in and got tested or seen for chlamydia or gonorrhea at the, primary care, doctor. And so, some of the resources in Pierce County, again, like I mentioned, the health department, we do have a clinic, here, and then we do have, Planned Parenthood, they do have a Tacoma location, Seattle location as well. CareNet Pregnancy and Family Services of Puget Sound, they have 3 offices, one in Tacoma, Lakewood, and Gig Harbor as well, that offers, services specific for, teens, and they're, well-equipped and trained to work with teenagers and that population. And then the other one is just the medical offices at like, urgent care or, their primary care provider that they usually see for other things. So as far as, what we do at the health department, we have clinic days like Tuesdays and Thursdays where we actually have an actual provider, providing, treatment. So we do work with residents from like community health care, during their rotation, and they will come in and be the provider, providing treatment. On Tuesdays, we run it in the morning from 8 to noon, and then on Thursday, it's an evening clinic from 4 to 7. So usually, we can take patients on a walk-in basis, but some of them usually will be scheduled, based on the cases that we've received, and then our disease investigators would have called, the patient and asked them, can you come in on this day, for your treatment? So we'll have them kind of like an appointment just on the board that we do know so-and-so is coming in, but if we do have people walking in, then that's fine, we can still, see them during those times. And then Monday, Wednesday, and Friday, the clinic is open from 8 to 1, but we don't have, an actual provider doing the treatment, but they can come in for results, they can come in if they walked in and, needed to get tested, or if they had questions, if they wanted, counseling information. We do have those services available, but if there was, the need for like urgent treatment, then we usually will refer them to CHC, Community Healthcare Clinic at Hilltop. That's one of the clinics that we work with, so usually we'll just send them over there if there's a need for urgent, treatment on that day, but if not, if they're able, if it's something that we can work with and see, they can come back, say, on Thursday when we have a provider, then that is another option that we can have them, come back during the clinic hours. And then everything is confidential, no insurance is needed. If they do come in, not because they were referred or they were a partner named, from a case that we were working, then, the test is $30, and that is per site, tested. So with chlamydia and, gonorrhea, what that means, especially with the MSM population, we will also test, in the throat as well, and the rectum, so that's why it is per site, tested. It's $30 per site, that we test, for the test. And then, so the referring partners, like, so if I was working a case and the index patient gives me, 2 other partners, who they may have been involved with, then I will try to reach out to the named partners and have them come in to the clinic for testing and treatment. And for those, that service will be free for them because they were exposed to that. So we will call them and have them come in for free, testing and treatment if needed, as far as that. And then we also will do, like the high-risk population being, one of them being the MSM population.
Can you define them?
Yes, my apologies. MSM population, I do this every day, but I forget people are not in the same role that I am, so I apologize for that. MSM, men who have sex with men, so we just refer to them as MSM. We do consider them a high-risk, population. If they do come in, then we will offer services to them, for free, as well. Like in the clinic, I have a big basket in the lobby. It has free condoms, lube, and they are more than welcome to take as many as they need. We don't ask, but we do encourage them to take them with, as part of their counseling, once they're done with treatment, we will encourage and they will take those with them. As far as, if we have any, clients come in and, for risk of exposure to HIV. So we will do like the testing here, but if it's like MSM population, we do recommend that they get on PrEP, which is pre-exposure prophylaxis. It's 1 pill a day, but we don't have the services currently at the health department. So what we do is we will link them to community healthcare CHC clinic at Hilltop, and we'll make the first call and let the nurse know at the clinic that we're sending so-and-so and his initial labs or his initial labs are done, and we'll send the paperwork over, and then from there, CHC will take over the care as far as PrEP and any other labs that will be needed for that as a follow-up. So, yeah, HIV pre-exposure prophylaxis, we usually refer to it as PrEP. And so the main thing with this, which was a big change and a big win for public health and HIV and STD clinics, is they usually recently expanded the use to include adolescents and then weight-based. Initially, before this change in law, it was specifically age limitation, and we were running into issues where we have teenagers come in, but because of the age, unfortunately, providers could not put them on PrEP. So with this change in the law, so long as you're about 77 pounds and the doctor that you're working with, the labs and everything check out, then you can get started on PrEP, which is 1 pill a day that they have to take to prevent HIV. And as of right now, it has been very successful with up to 90% prevention, like, of getting HIV. And then we do still will encourage especially the younger teens when they get on PrEP, that they still will need to use condoms, because it has been an issue even on social media that, it's just 1 pill. I just have to take 1 pill and I can still continue, doing everything else that I was doing. So that's one thing that we're trying to counter, that yes, it is just 1 pill a day, but we do still encourage and will counsel them to still continue using condoms to increase the efficacy of prevention. And then as far as for people who ingest drugs, then research has shown that it has up to 70% being effective as far as preventing HIV. So most private insurance and Medicaid plans will cover PrEP, but we do have other like statewide resources that we can refer to get assistance with getting coverage with the medication. So cost should not be an issue. Why, even if it's a teenager and they really want to get on it, cost is not one of the barriers that we have right now, because statewide in Washington, they have really made sure that that is not going to be a barrier for anybody who wants to get into that. So that is something that most doctors are aware, and we're aware of. So if we have a situation or we get any calls about that, then we do have people that we link them to, and we make sure they can get access to the drug without any barriers as far as cost goes. So the other thing, especially for teens and in schools, is the expedited partner therapy that we try to make sure when we see teens coming into the clinic, we can give them a pack. I will have Kate help with this. That expired, so please, it's just for teaching moments like this, or when I go out to clinics and things like that. So expedited partner therapy, or EPT, in short, as we call it. So it's just giving medication to an index partner who came to see me or the provider of the clinic, and they will get a pack to take home to their partner. So that way, the partner doesn't really need to go see a doctor, and that way we're trying to avoid the cycle of reinfection where we treat one person and then the partner doesn't get treatment, or they don't want to go into the provider's office. So these packs, usually I do have them and I do take them out to clinics. We have clinics that have enrolled to be EPT participating clinics, or if we have a clinic that is usually seeing like a large number of people, then I will get them linked up with the Department of Health, where they get the supply directly from Department of Health. And so the goal with this is, over the years, and even talking to clients down the clinic, is we're trying to avoid the barrier where we give somebody a prescription, because we were giving our prescriptions, but they were never getting filled. So then we call back and we're like, oh, we gave you a prescription for your partner, but then they're like, oh, I do want to go to the pharmacy, or I don't want to wait in line in the pharmacy. So that was one of the barriers that we've seen in trying to reduce the infections, especially with chlamydia, is to make the packs, have them ready to go, and then once I'm done with the index patient, I'll be like, okay, we have one partner or two partners here, the packs ready to go. And in the packet itself, it does have information about the medication, the antibiotics, and we get questions about, well, what about somebody doesn't know if they have any allergies or anything? Can I take medication without having been seen by a doctor? So those are some of the questions that I get, especially when I go to clinics to get them to enroll to do this. And the thing is, the last few years when this started, we have not had a single case of a reaction because somebody took the antibiotics prescribing EPT. So and even nationwide, there hasn't been any reported cases of anaphylactic reaction or somebody just having any issues because they took medication that was given to them in a pack. But then at the back of that, there is information about medication or contact information if anybody was worried about just taking it. So the goal is to have these packs out in the clinic so providers can just have them ready to go and avoid the use of sending prescriptions to pharmacies, because then we were just calling pharmacies and we have all these 10 prescriptions waiting and nobody came to pick them up. So that was not an effective way, especially with the increase in chlamydia and stuff that we were trying to work with. So that's one way to counter the rates that we have in Pierce County. Is we're really pushing the use of the EPT packs. And so there's other pharmacies that are currently enrolled in EPT and they participate in EPT. So not a whole lot of them. We have a few Rite Aids and Bartels, but and then the Fred Meyer down here across the street. So if any of the providers or in the clinics, what I tell them is if they send anything to any of these pharmacies, it is free, so the patient can just go and pick up the medications. But then again, we are running into that issue. People just don't want to go wait in the pharmacy, or they just don't want to make the extra trips. So like, I was already at my doctor's office. Why should I drive to the pharmacy and it's not my medication? So we're trying to get as many doctors. And so based on the map right here is the actual clinics in Pierce County that are EPT participating clinics. So we are working to get more clinics on board with this. Like I said, it's something that I will drop off the packs to the clinic so they don't have to worry about it. And if you have a clinic that is, having a lot of traffic, seeing a lot of patients, then we will get them linked to get the packs directly from the Department of Health. But I have had issues where, like, Fred Meyer Pharmacy will call me and be like, we're out of packs, and that is something I could easily fix. I will just drive down to them and give them the packs, because we want to make sure that nobody goes home without treatment, especially for the teens. And usually this seems to happen on a Friday evening, so usually on Fridays I try to have my phone close to me, because it has happened like it's 4:25 and I'm about to leave. Oh, we don't have packs and I have 2 people waiting. So then I will make that effort to make sure that, especially because of the weekend, especially for the teens, because we really want to make sure that they get access to treatment as soon as they get tested. So this is one project that is still ongoing, hoping to get more clinics on board as well, to get the EPT packs. And as far as contact information, I have my information up there, and Kate Cronfield, who put together this presentation. And then the 798-305, that's the main line to our clinic downstairs. We do have a technician that is on the line and available during the clinic hours. So if anybody has a question, they are more than welcome to call. And if they need like a nurse or anything, then they will page me or they will direct the call to me, and I can help with anything that comes up. And on Thursdays, we're open late just from 11, just because we run the late clinic. That's the only difference with the hours. But usually I'm here from 7 in the morning, but the clinic staff doesn't get there till 11. So on Thursdays, people, you can still call me. That's my number, and I'm still here. Just the main clinic is not running until 11. that is all I had for you today. Let me know if you have any questions or concerns or anything I can answer.
All right.
If there are no questions,
Oh, I actually just have one thing, Chad. You were talking about, so, under the age of 15, or over the age of 15, students can come, or kids can come and get, any reproductive health, and the insurance billing charter that you're talking about. And there's a thing called Take Charge application, and students can, it covers limited screening for STDs as well as birth control and everything. And that's a way for, it's like, it's the person's individual healthcare, like insurance that's separate from the parent, if that makes sense. So every year they reapply and it's their own insurance that's not billed to their parents' house and nothing like that, that, will cover those costs.
Great.
And it's confidential.
So take charge.
Take charge.
Okay, perfect. I learned something new as well from this presentation, and I have it down, and I will add it as part of our resources for the clinic as well. Thank you.
Thank you guys for coming. So again, my name is Lucerito. I'm a mental health professional, or just a fancy way of saying counselor. I do work for Consejo Counseling and Referral Services. We provide mental health services. We also provide substance use services, and we also have peer counseling services. We're located on South Orchard Street in Tacoma, and we work out in the community. That's just a little tidbit about us. So going in here, I'm going to be kind of going over a few things that Oasis Group kind of spoke about too, but we'll get to that. So this is going to be our layout for tonight. So I think the most common theme tonight is going to be let's talk about these issues that we're having difficulty facing because they weren't brought up to begin with in the beginning. And so now we're trying to catch up with all this new information on how we can help adolescents, how we can help young children, and even young adults. So let's talk about relationship myths, warning signs, what teen violence looks like, our duty to warn, tips to help teens, and tools that can help us. Right. So a lot of people come up with relationship myths. Number one that sticks out the most is jealousy and possessiveness are a sign that that person really cares about me. That's a sign of true love right there. If they're worried about me 24/7, who I talk to, they're just protective. The fact is, the most common early warning sign that a relationship may become abusive is when one partner becomes more territorial. Jealousy signifies that they don't trust you. And so you can't be trusted to talk to people of the opposite sex, generally, or of the same sex, without the person present with you. And so a lot of this information is going to be coming from Rape and Abusive Crisis Center, and they have a .org for that. Relationship myth 2 is it can't happen to me. Most people believe that abusive relationships happen to people with broken homes. That's not the case. The case is anybody, any color, any sexual orientation, any religion, it happens. So approximately 1 in 3 adolescent girls in the United States is a victim of physical, emotional, or verbal abuse. 1 in 10 high school students have been hit, slapped, or physically hurt by their partner. Relationship myth number 3. Relationship violence isn't really that serious. I personally have people who tell me, well, I hit my boyfriend, I hit my girlfriend.
when I get mad. That's how I deal with my anger. 30% of women ages 15 to 19 that have been murdered by a boyfriend or husband. Oh, that's the percentage of that age group. Sorry, wrote that wrong. And then the severity of intimate partner violence is often greater in cases where the pattern of abuse was established in adolescence. So this goes for those high school sweethearts, middle school sweethearts that have been together for a long time. And those warning signs are right there. Relationship myth 4. Men are abused by women just as often as women are abused by men. This is one of the facts that I don't really agree with, because men don't report it as often as women. So there's not a really defined, but this is for all those that are reported, all the cases that are reported. So women ages 16 to 24 experience the highest rate of intimate partner violence. Women also report more incidences, like I said, than men do. And women are 10 times more likely to be abused in relationships than men. Now, statistics I also want to add in there is sexual abuse. So that's 1 in 4 women that are sexually abused by their partner or have been abused by someone that they know. That statistic is 1 in 6 for men. Myth number 5, alcohol and drugs cause a person to be abusive. Many people who are the abuser in relationships don't actually use alcohol or drugs. Abusers who do use, they continue to become abusive to their partners even after becoming clean and sober. Any questions on that? Okay. So relationship myth 6 is verbal or emotional abuse is in a relationship is no big deal. Actually, research suggests that verbal and emotional abuse can even be more severe than physical. And the reason for that is because verbal abuse creates pain and trauma. And the symptoms don't necessarily show up automatically, and they cause a more physical symptomatic symptoms that you'll see. So you'll see them feeling sick, getting headache, things like that. And then we also begin to believe the negative messages that our abuser tells us. You're worthless. No one will love you as much as I will. Things like that. Oh, sorry. I'm just going to walk over here real quick. So here we have, this is what I give all my clients who come to us for DV. That can be adolescents or adults. DV stands for domestic violence, and this is the DV wheel. This is what happens in relationships. You begin here at the honeymoon stage. So inside, I like to point that these are all the symptoms of the abuser. So these are the warning signs that you'll start seeing. In the honeymoon phase, I'm sorry. You know, they beg for forgiveness, promises, let's go to counseling, I'll never do that to you again. And the victim usually agrees, returns back to the person, feels happy and hopeful that this relationship is going to work out. Then the next stage is tension. This is what we call walking on eggshells. You're careful about the things that you say, you're careful about the things that you wear, because there are rules in this relationship, and they're not created by the partner together. It's one-sided. And then you have the explosion. It's that one thing that you said or that you did to set off your abuser. And that usually results in verbal abuse, emotional abuse, physical abuse, or sexual abuse. You guys have any questions? Yes. Sorry? Yes. Good question. So what she was asking is, in the center here, we have denial. So if someone is in the stage of denial, how can you guys as educators help someone in that stage? Sorry, I had to hiccup. That's a difficult question because it's really up to that person. The only way you can show someone that there are options is to show them that you are supportive and that you create a safe space for them to come to you for. Because they're not ready to end the relationship if they're in denial. Does that answer your question? Okay. Okay, so let's talk about warning signs. These are signs, just a few, of what it looks like when we are with an aggressor. Constantly checking our phone, social media, email. They're jealous, possessive. They use, sometimes it might sound endearing, like, you're my girl, you're mine. Don't talk to them. I don't like that person. And they're controlling. You can't wear mini skirts. You can't wear that cologne. You can't talk to these people. You have to call me multiple times a day. When I call, you answer. When I text you, you respond. Frequently losing their temper. Anything you do will set them off. If you ignore that phone call, if you ignore that text message. And then putting that partner down, telling them negative comments, you can't do this, people going off to college, you're not smart enough, you're not going to be successful enough, you won't make it without me. And physical abuse. So these are signs that we see in usually the victim. Their grades start slipping. Maybe they isolate from their friends, they drop out of sports, they don't talk to their family. Changes in mood, maybe they get into arguments with their parents and they have a really healthy relationship to begin with, but now that relationship is strained. They become secretive. They defend or excuse their partner's behavior. Oh, he hits me because he loves me. Oh, she's just jealous. Engaging, this one. Bruising around the wrists, abdomen, upper arms, face, and legs. I recently, it's not on here, but I recently found out that there are other ways to also tell that aren't conventional because they become smarter in their patterns of doing it. So it's not just bruising, but it also be scratches. And sometimes it'll be where clothes are covered, or it'll also be along the hairline or within the hair so that people can't see. They also engage in drug, tobacco, and alcohol use. And often they might have thoughts of suicide. So what does it look like? The Centers for Disease Control and Prevention, so the CDC, did some research. This is what it looks like. Physical hitting, slapping, touching, kicking, etc. Sexual, any unwanted touch or force of sexual activity. So this kind of ties along with what Oasis was talking about on how consent is a huge issue, and it is. Financial, this is controlling of funds. And I know like high school students have some jobs and everything like that. So this goes kind of to that because that still gets controlled even in high school relationships. Social, spreading rumors. If you don't sleep with me, it's okay because I'm going to tell my friends that we did anyway. Using religion. We're together. So it means that God wants us to do this. Maybe it's the culture, right? Sexting is a huge thing today. However, it is illegal for anyone under the age of 18. This is a crime, even for people under the age of 18. The reason for that, it is considered child pornography, and it doesn't matter if it's two 13-year-olds sending it to each other, it's still illegal and a crime. Verbal mental threats, so name calling, putting them down, gaslighting. I'm going to take a moment and explain what gaslighting is, and that's basically a manipulation technique that the other partner does to the other, where it's an invalidation of their concerns. Oh no, don't be concerned. That's not true. I do love you, and this is normal. This is what couples do because they're in love. Your feelings are wrong. You're not in danger. I'm not hurting you. I'm not keeping you in the relationship. You're free to go, but you won't make it without me. Questions? So let's talk about helping. State of Washington, one of the laws here is that domestic violence, so DV shelters, shall make available to any person who is a victim of domestic violence and that person's child. So in the state of Washington, that just means anyone between the ages of 18 and older. But I know a lot of this is geared towards adolescents. So according to the law, there are no laws that specifically protect or serve adolescents against domestic violence in the state of Washington. But the state law allows minors 13 to 17 to receive mental health services without consent of parents. Another amazing thing about Washington is that we have so many resources out there that can help. One of them is Washington State Coalition Against Domestic Violence. These guys are amazing. They provide support, resources, and most important, safety planning. What is your plan? How can we help to get you to safety? You don't need a parent to come do this because they have those resources for you. There's a couple in Seattle, and they have a campus in Olympia. But there are other resources around the Tacoma area. There's Crystal, the Crystal Home, and then there's also WYCA. So sorry, I'm not a native to Washington, so. But yeah. However, the cool thing about Washington Washington is you can get protective orders for anyone over the age of 13. However, you need a parent present with you. You need a parent to do this for you, or a trusted guardian to help petition for a protection order. So that means if someone in the relationship, so like someone who's 16 plus, they legally can go get a protection order for themselves. But if they're under the age of 16, they cannot. They would need a guardian or a parent to help them with the process. The only downside is that once you put that into motion and sign that paperwork and have it filed, the state of Washington doesn't have to tell you if it's been approved or put into order. And that's something that the parents have to do, is go check in on it. So who's mandated to report? Social workers, myself, pretty much everybody in this room. So report any abuse. So basically, looking at the WAC, right? Duty to warn. Report any abuse or neglect of a child under the age of 18 to CPS and law enforcement. Book and document to cover your end. And it's in case of peer by peer cases, there are no laws to mandate to report unless there is reason to believe that the adolescent is being seriously or physically abused. So that means you can't make a report if a 14-year-old is being abused by a 16-year-old partner unless you see physical marks or you have reason to believe that that person is in serious danger. What can we do as adults? Identify their support system. Who's there for them? Be genuine. Use their preferred means of communication. Maybe they can't talk to you in person because they have difficulty with that face-to-face eye contact. Social media. But this is helpful too. Refer to your agency's protocol. I'm assuming teachers, you can't really text with your students. Yeah. Remember, adolescents are experts of their needs and their wants. Ask them questions. We don't understand their language because it changes. When I was a teenager, things meant different things. The pound sign was still the pound sign, not hashtag. So ask them, have them put it in their language because they know more, they're their educators for you. What is it exactly that they're looking for? And what can you do to help? So let's talk about helping them. Be supportive. Another thing is, how many of you were told that you don't know what love is at 13? Right? Yeah. How many of you guys have teenagers of your own? I wasn't allowed to date until I was 33. I'm only 28. I don't know what love is. The whole mentality. So be supportive. Because they do know. Validate that. Yeah, you're in love. It's tough. That's the important thing, is to establish clear boundaries of healthy and unhealthy relationships. How do we do that? What was your messages growing up about love, respect? I grew up in a very toxic family, not a household family. I saw a lot of unhealthy relationship behavior. Lots of unhealthy stuff.
So growing up, we learn how to treat our significant other by the way our dad treats our mom. If you have if you have two moms, whatever household you come from, we learn that by the people that raise us. We learn that by our friends and their families. Social media, television, movies. Implement healthy relationship courses into the curriculum. This is a hard one because some schools are implementing it and some schools are having a harder time to teach it. What age can we really what ages can really benefit from this? My personal opinion is that we start as early as preschool. Teach them consent. No means no. A giggle and a no still means no. What I'm wearing still means no. You know, until I say the words yes, and I mean them, respect myself. How can we do that? Improve self-esteem. Show students what it's like to have them respected. They have ideas, they have beliefs, they have values. I know growing up for me in high school, I was placed in a box. I'm Hispanic, so I should have a child before I graduate high school, if I even graduate. Also, so one little tidbit, when I was born, I was betrothed, meaning my marriage was arranged. My father is from Sinaloa, so what ends up happening in Sinaloa is that when you get married and your spouse doesn't like your behavior, your attitude, what they do is they send you home. You're married, they send you home to be fixed. I grew up in America, so there's no fixing. But that was the mentality that I grew up with. I had to be, anything were to happen, the mentality was your behavior created that distress in a relationship. What did you say? What did you do to deserve that treatment? So trying to change that kind of mentality. What you do and what you say doesn't mean that you were asking to be hurt in the relationship. Help them identify their support system. Research shows if you have a healthy support system, you can bounce back from anything. So who is your support system? You guys. Family, friends, community outreach like Oasis. No judgment. We've all been there. We've all felt that puppy love or adolescent love, the all-consuming love. You do anything for it, no matter what. And the more somebody told you it was a bad thing, especially an adult, made you want it even more. Meet them where they are. If they're not ready to change, like they're in the denial stage, meet them where they are. Provide them with support, provide them with psychoeducation, research. That might not get their attention, but just let them know, I'm here. Safety plan. If a student comes to you for my boyfriend, my girlfriend, my partner, they say mean things to me. They hurt me. Well, do due diligence, try to figure out exactly, talk to them. The number one call I get is, I see from a lot of the school social workers is, oh, this student is coming to me because their partner hit him. Do I have to call the cops? Do I have to? No. listen to the story first. Listen to what they have to say. And usually at the end of that, they'll tell you what they want. So safety plan, how do you do that? What is your plan? Who is your support? Who can you ask for to get help? Where can you go? Are they homeless? Do they have a home? Do they live with family? Who are those people? Do you have a number for maybe 911 is a good number to call if it's like a serious situation. Maybe it's just a Pierce County crisis line. Maybe it's a hotline. I just need to talk to somebody who's been through the same situation. Establish trust. If you don't have that trust with that kid, there's no way you can reach them. I see it in my job. If I don't establish trust first, there's no way. Discuss and offer options. What are the students' options? After you've sat there and you listen to what they gotta say, list their options. Well, we can sit down, we can call your parents. If you're not comfortable with that, we can I don't suggest bringing the partner just yet. Refer them to a counseling center. Especially if they're over 13, you just refer them. Our referral numbers are here. We see children ages 13 plus, and they do not need consent from their parents. We go to the school. We'll meet them there. So these are some resources. I love this book. It's called the Teen Relationship Workbook. Such an amazing book. It has worksheets for students, middle school to high school. Amazing. Dating Matters, Strategies to Promote Healthy Teen Relationships. So this is kind of like the CDC has this violence prevention, and you can establish this in a health class, and just use it kind of like as a worksheet. But it has different curriculums, lessons, that questions. And if you would like some more information, please don't hesitate to ask me or anything like that. I'll leave my email, and I can email you this information as well. Or me.
Can this be sent to us by email?
Yeah.
That would be helpful.
Yeah.
I think everybody's trying to bring them.
Yeah. I will send the presentation slides to everyone.
Respect effect. So small actions make a big difference. This is futureswithoutviolence.org. They have some really great, useful information on there as well. I believe they even have an online or mobile app that you can use. And this allows the students to have questions that have been created by their peers who've been through similar experiences. It provides them with psychoeducation, data, things like that, so they can hear it in their language. Prevention programs. So youth.gov. They have a couple here. Sorry, I squished them all together. So number one is the Safe Dates Project. A lot of schools have implemented this as a curriculum or an after-school program led by their social worker. Of course, it has to have consent and be approved by students, and I'm not sure if parents have to agree to it, but we'll see. Break the Cycles, Ending Violence curriculum. The 4 R's. The 4th R, which is respect. And the Youth Relationships Project. That's another one. That's the 4th one. And Shifting Boundaries. This one is specifically geared to the Latin male. population. I also believe it's important to develop a peer group with just peers. Can be student-led, someone who's been through it, someone who has information. You can even have the school social worker or something like that, or if you can find a group that caters to this and refer them out, it's definitely helpful, because there is no power stronger than their peers. Because at this age, it doesn't matter what the adult says. It matters what their peers think. And so when they can find like-minded people, you'll see immense progress. Talk to them like adults. That's important too. They may not be adults. Who here got the whole act your age, or act, if you want to be treated like an adult, but then when you act like an adult, you get told, you're just a kid, what you know. Yeah. Same thing. They're at that age. They want to be adults. They feel like adults. Everything feels real for them. Just honor that. Okay, so I have some resources here, references to, so for resources, CDC, Rape and Abuse Crisis Center, Washington State Coalition Against Domestic Violence. And those are the pictures. When you guys first came in here, you guys have a healthy relationship quiz. This is from loveisrespect.org. Another great website to get information, tips on how to talk to teens. I give this to all my kids who tell me that they're in a relationship, because half the time they don't even know what's happening. They don't even know what kind of relationship they're in, because they think it's normal, because that's the only one they've known. So this is a great self-scoring questionnaire. Hand it out, and they get to, oh, I'm intrigued. And this website's really great. It has interactive for adults and adolescents. Another one I did not include, because it just got sent to me. So this is called Kids' Health in the Classroom. So I figured this is more geared towards your guys' profession, but it has everything from, this one is just for teens, but articles for teens, love and romance, am I in a healthy relationship, abusive relationships, how to break up respectfully, and getting over a breakup, because that's it. So these are really great. I also have some discussion questions you guys can talk to with your students. I'll add that information. I'm just gonna have to make it prettier. I'll add that information so then that way you can get there.
Did you read the office?
Yeah, this piece of paper right here, so it's just, someone just sent this to me this morning, and I didn't get an opportunity to put it into the slide, so.
That's one you.
Oh, I'm gonna add it, don't worry.
Oh, I was wondering, because I can't hear a whole lot.
Okay.
That's gonna get passed back on her.
Yeah, it'll go pass through her, and then,
Send us email.
yes,
Thank you.
yes, you're welcome. So discussion questions, this is actually one of the packets that they hand out for, grades 6th to 8th grade. And so it has activities that you guys can do with students. This one is, it's called Raise a Red Flag. Technically, you can get a red flag, but you can use your right hand or your left hand, whichever one. There's also relationship bill of rights and responsibilities. What are your rights in the relationship? What are your responsibilities in a relationship? Are you guys comfortable with doing an exercise? Okay. I'm going to read a couple of these questions off. All you have to do is raise your right hand if any of these questions apply to you at any point in your life. Your partner says, I love you. you about where he or she is going. At any point, at any point. Gets jealous if you talk to someone else. Constantly accuses you of cheating when you haven't. Asks what you want to do on the weekend. Makes an effort to get to know your friends and family. Cheers you on at games or recitals or at work. I have that one in there. We're all working people now. Puts you down. Understands that no means no. Makes decisions for you. Sometimes my husband orders my dinner for me if I go to the bathroom, but he thinks I want, and he's right, because we go to that place all the time, so. Yeah. Compliments you. Seems obsessed with you. Blames you for things that go wrong. Says no one else would ever want to be with you. Makes you laugh when you're sad. Criticizes you. Breaks things in anger. Wants to know where you are at all times. Pressures you to do things you don't want to do. Respect your opinions. Makes you feel guilty for having outside interests. Threatens you when you don't do what they say. Tracks you down when they can't find you. Expects you to stop seeing your friends. Calls you names. Pushes you around. Is proud when you succeed. Thinks your interests are stupid. Tells you that you're lucky to have them. Hits you. So the whole purpose of this is to see like the red flags. The red flags are obviously the negative parts of it. But the thing about abusive relationships and unhealthy relationships is that there's good with bad. And that's why they stay. That's why they stay. Because it's not going to last forever. That moment is not going to last forever. And that's why they stay. Because maybe there are more good moments than bad ones. Maybe the honeymoon period is longer than the explosion. Any questions?
I've done that activity with my students, and I give them a green and a red marker. So, and I say, go through and highlight all the red, or, the red flags, and the green.
Do you mind if I steal that?
No, I'm just
Okay.
saying, that's how I do it, because I don't have a lot of red, I don't have red flags.
Yeah.
I always have markers.
Okay.
Yeah, and I just have to do it as a discussion group.
Mhm.
And then what I do is, we'll discuss why did you say that was a red or a green? And I tell them, we're all learning what red and green is, what's good with that right now. But I do like to get help, I use that a lot.
Yeah. I didn't know about it until this morning, so I'm so glad that that's a new resource for me. Thank you for sharing. Anything else? All right. Like I said, my name is Liz Dorito. I'm with Consejo, and that is our referral line. Thank you. All right. Thank you so much, Liz Dorito.